Hello, everyone. Welcome, welcome. This is a really exciting day. This is a really exciting time, and you can decide what exciting will mean for you. My name is Faith Spellbring. I am the Executive Director of ALMA, the Association of Lutheran Mission Agencies. Many people on today are members of ALMA, which is fantastic. Hello, everyone. Miss you terribly. I'm still hoping and praying that we'll be able to get together in person one of these days soon. Until then, you are on our thoughts and in our prayers. For those of you who are new to ALMA, ALMA provides spiritual support, continued education, and networking opportunities for mission agency leaders, leaders of registered service organizations and societies, as well as mission-involved congregations and individuals and businesses. We help God's leaders in their specific efforts to reach people with the gospel of Jesus Christ. We do that by providing a few things. We are an identifiable entity for those who represent, operate, and promote their respective mission societies and agencies. We provide a setting for professional interaction and personal sharing among those involved in leading mission activities in the United States and in other countries. We also provide an organization that fosters a spirit of trust and teamwork among mission organization leaders and related entities. So in short, ALMA is a collaborative group of mission leaders who recognize that we can do greater things for the kingdom of God when we learn with and from each other. So today, we are gathered here for the first of 3 webinars in a series that ALMA has put together. This series specifically addresses the needs that have arisen from our mission agencies because of the COVID-19 outbreak. The virus and quarantine measures have taken a toll on a lot of people, ministries, congregations, etc. And that toll has come in ways that are physical to our bodies, not just with the virus, but the effects of quarantine as well. It has affected our emotions, our relationships, our finances. And so this video series of webinars is really here to address just that. Our webinar series is called Staying Healthy and Leading Healthy Mission Agencies in Pandemic Times. Today we're addressing the physical aspect of leading God's mission during the coronavirus outbreak. And in June, we are going to address the financial health for our mission agencies during this sort of a worldwide crisis. And we are going to, in July, be addressing what the pandemic has, the toll it's taking on our emotions and our relational health as mission leaders. The speakers we've invited to address these topics are really going to unpack the topic for us and provide answers to our questions. We invite you to click down below. There is a chat feature. So if you do have questions that you have not already submitted in advance, please use the chat feature, and I will be keeping track of that, as well as some of my helpers on this call today. And thank you, Pat, for helping me monitor the chat. Some of our speakers will also be providing tools or resources for us for continued understanding and continued learning on these various topics. So today we are blessed to have Dr. John Lautenschlager, and I am going to have John share his video right now. Go ahead, John, and start sharing your video. He is our presenter for physical health for mission leaders. From a very young age, John wanted to be a missionary himself, and he was able to do that as a medical, with the medical profession. So he's a medical missionary. He worked in Nigeria in village-based care clinics, and then he worked in Sierra Leone among the Kono people. After about 2 decades of international ministry and missions, Dr. Lautenschlager served in a family practice in St. Louis and continued to serve the church on various boards and at the seminary and whatnot, using his both missionary experience and medical experience to bless God's people there. So we are going to have him, we're thrilled to have him with us today. And I think I need to invite him to share his video. Sorry about that, John. So as he comes on here, We are going to have him share with us. He's really going to speak on 3 topics today. First, after unpacking the issues that we have, that we're experiencing, he's going to sort of come alongside us in our struggles with the physical aspects of this virus. And he's going to address for us, how can we care for our own personal health during this time? How can we care for the health of those in our ministry, our employees, our volunteers, our constituents, the people we're trying to serve? How do we help keep them safe as we are expecting this rollout of quarantine lifting and whatnot? And then finally, we'd like to know what's been going on with this pandemic regarding global missions and the state of our missionaries overseas. So John, I haven't seen you pop in yet. Here he comes. Oh, John, yay. Thank you so much for being with us. I'd love to pray with you before you present. Would you guys join me in? Thank you. Would you join me in prayer? Gracious Heavenly Father, we thank you so very much for your saints around the world who, no matter what this world throws at them, will go to great lengths to share your gospel with people who need you, Lord Jesus. I specifically thank you for John, for the work that he has done to serve you here and abroad. I pray, Lord, that you would be with him to give him wisdom at this time. And I thank you for his willingness to help us learn how to keep ourselves, our constituents safe during this time, and really open our eyes to what we can expect as we try to plan for the future, Lord, as your leaders. Be with John. Thank you for him, for his entire family, and into your hands, Lord. All we do is in your hands, where it is most safe. In Jesus' name, amen. John, take it away.
Okay, well, thank you for this opportunity to talk to people who are interested. I see some familiar faces popping up here and some that are not familiar to me. Basically, we're dealing with an enemy, and we really, I think, can use that metaphor of a war as we deal with this coronavirus. So most of the metaphors that we use regarding any kind of war would apply to this one. And I would like, first of all, to talk about what our enemy is, who our enemy is, that has brought the whole world basically to its knees. And first of all, let's talk about the strengths that this virus has, and then later I want to talk about its weaknesses too, because that's how we are going to attack back. First of all, the coronavirus isn't just another virus. It's one that we've never seen before, and it's one that kills people. It can kill up to 15% of people in certain categories, and those categories are very easy to define. First of all, it's the old people, and as you get older, you become more at risk. We've had people over 100 who have survived, but many people, even in their late 50s and 60s and 70s and on, don't make it. So it's very dangerous, and it also does seem to have some effect on little kids too, in terms of the reaction to the virus rather than the virus itself. Although that's kind of rare. So this is really a killer. But the main thing I think that makes it so dangerous to us is it is a great mimic. It can mimic the common cold. It can mimic the flu. It can mimic pneumonia. And even more dangerous, perhaps, is that it can become very silent. We can have it and not even know it. And the next important strength that it has that we didn't know about at the beginning is that it's very contagious. What that means is that one person infected can infect, on average, up to 5 people. We didn't know that either when we started to deal with this virus. We didn't know how many people it could infect, and most importantly, we didn't know that it could infect people by spreading from people who had no symptoms whatsoever. That's not so common, but it does happen that people who have absolutely no symptoms can spread the virus, and that's how it got to many places in the world now, and essentially every country in the world, every continent except Antarctica has had it. Another strength that it has is that when it hit us, we knew very, very little about it. We have learned a lot, but we still have very much to learn about the virus itself and what it can do and what it can't do. One of the biggest dangers that I see is that it can instill an irrational fear in some people, and at the same time, it can lead other people to complacence, where they take it as just a little thing, because most of the people, probably somewhere around between 98 and 99.8% of the people who are affected by this virus are not going to die from it. We don't really know exactly. What we do know is that the cases that have come up and been recorded, we have a death rate among those people of around 2 to 4%. Now, this may be much lower because a lot of cases are silent, as we have learned, but we have to assume that it can kill a lot of people, so we have to be careful with it. One of the things that it can do is also, in addition to spreading fear and complacency, both poles, it can also lead people to get involved with a lot of political differences. And this is not just in the United States here, but it's also throughout the world, where there's a lot of differences of opinion and people fighting to get their opinion on top. It has really got us by the tail if we are not careful with it. The next strength that it has is that we don't have any good medications that are going to cure it miraculously. We have some that are helping, things like remdesivir, of antiviral that was useful against Ebola. Seems like it might help some. And we also have the plasma from people who have recovered and have antibodies, and we can give that to people who are very sick. But these are not miracle cures. One thing that we have learned about it that is really a problem is that it can spread very quickly in crowded spaces indoors. Big meetings inside a crowded room. I remember going to a concert, and there were a lot of people there. This was, I think, in February. Fortunately, it had not hit Oregon yet, where I'm living, in a big way. But it could have been there, and I didn't know it. It can spread, especially in public transportation, like the subway system. And I think that we're going to find out, we don't know for sure, but I think we're going to find out that the subways in New York were probably very much responsible for much of the spread of this virus. So it can spread easily. It doesn't spread easily outside in the open air where you're staying away from other people. So that is one thing that it can't do. Now let's talk about some of those weaknesses where we can attack this virus. First, and I think probably in the long run is going to be most important, is that this virus is genetically stable. That means it doesn't change like the influenza virus does, and we have to make a new vaccine against influenza every year. And we have to guess what that strain is going to be based upon what is circulating in the southern hemisphere for the northern hemisphere, and vice versa. When summer comes around here in the northern hemisphere, the southern hemisphere will be facing what we've been dealing with up here. So this virus is stable. It's not going to be changing that much, most likely. We don't know for sure, but most likely we will be able to make a vaccine that will work against it. The next couple points that are related to its weakness is that we have been able to have some control over this virus in the past. First of all, migration from one place to another, shutting down air flights, shutting down roads, and ship travel has been effective in not so much preventing the disease, but from delaying the time which it gets into the country. So that has made a big difference. And in fact, some countries are just really beginning the upswing of this virus as it comes in and multiplies in a country. We've made some good strides there, but the other thing that we've been able to do is what you probably heard about called flattening the curve. That is slowing the spread by paying attention to the ways that it is spread. And we are doing this in a number of ways. I think the most important one is what they call social distancing. And I don't like that word. I hear other people complaining about it too, because we don't need to distance socially as much as we need to distance physically. We do need to maintain contact with our family, our friends, our colleagues, etc. The mitigation that is working includes hand washing, which we all know about. We just need to be more careful about it. I just got word this morning on the news that the virus doesn't spread probably on surfaces as much as we thought it might. We do know also that heat and light and humidity can inactivate the virus, so maybe that is why we haven't had as much trouble as we thought we would with the surfaces that the virus is on. But we still have to be careful. We should still pay attention. If we go to the grocery store, make sure that we wash our hands coming back and things like that. But we are able to make a difference in the spread of this virus by paying attention. One of the next things that we do need to pay attention to is that if we are in contact or might have come in contact, we need to be extra careful. We know that because it affects old people, those of us who are seniors need to be more careful than the rest of us in making sure that we follow those rules. The rules are the same, but we need to follow them and maybe be dragging our feet just a little bit when it comes to following the rules. We are working on vaccines. We have some good news that we might get a good vaccine, and we are pushing that thing ahead as fast as we can, but it still takes time, so we need to continue working on the mitigation. I think the last thing that we need to think about as the weakness of this virus is that maybe in some ways it's thinking for itself. I don't know. It's more of a survival thing than it is a thought process. But we are able to think. We are able to rationalize. We can try things to outwit this virus. And this is what we're doing with the mitigation efforts and also with containment, which means that if it does get into a new place, we can put out the little embers of fire that might have turned into conflagration. And I do like to use that metaphor also of a fire, because you can put out the fire where it is, and you can put out those little embers to keep it from going somewhere else. And when it does go somewhere else, you get those embers put out, and then it doesn't leave you home free. You still have to be watchful that it doesn't come back again. But we can use our brains to think about how this thing is working and how we can work against it. I'd like to talk about some of the myths that have come up regarding the virus, because there are many people who have been putting things on Facebook. I see it all the time. I even got a phone call from Nigeria from a friend who was asking about what he should do regarding it, or the prevention of the virus, based upon things that he had heard. First of all, one of the myths I think that is easy to deal with, I think, as Christians, the idea that this thing is going to wipe us out. It's, talking about the darkest winter we're ever going to have, or talking about a Armageddon type of a picture. Sure, this is something that can be very dangerous, but we as Christians, I think, don't need to go with fear. We need to go with knowledge and understanding. The next myth is just the opposite, and that it is no worse than the cold or the flu. Sure, it can act like the flu or the cold, but it is definitely worse in the sense that not everybody gets the mild symptoms. If you're playing Russian roulette, you know that you've got a very good chance of not killing yourself. But you know that if you keep playing it, you're going to get into bigger trouble than you thought. The next thing that I've seen a lot of showing up on Facebook is that there are certain little things that you can do to cure it with some simple means. Everything from lemon juice to one of the weirdest ones I saw was that you could use this compound called chlorine dioxide, which is used as a bleaching agent, and it's a chemical that has been sold and promoted around the world. And I really recently, not so recently, recall that this showed up. People were saying that this was going to be a dramatic cure for malaria. And this was over 10 years ago that I think I first saw this particular thing pop up, and people are selling it to cure just about everything. And there are all kinds of other things that you can use to get rid of it. These are myths, and we need to look at the reliable information. The next myth is that you can just tell whether you have it if you check out, do you have these symptoms? Don't you have those symptoms? And if you follow these rules, you're going to know whether you got the virus. Well, I think most of us probably have heard by now, and it's true, that you can't tell whether you have the virus or not. And even if you could tell, it wouldn't change how you behave, because you know that you have to follow the rules of prevention, regardless whether you have it or not, and in terms of the idea of spreading it to other people. And I think the biggest kind of thing that I see, though, on the internet is the idea that there's some sort of a conspiracy going on. This one video called Plandemic has been making the rounds. Judy Mikovits, I think, is involved, and she was a virologist, but somebody who has been promoting this more of a conspiracy kind of a viewpoint, speaking, trying to discredit Dr. Anthony Fauci, who was one of the people that, if you've been paying attention, probably have seen speaking about what our country is doing against the epidemic. Another one, the Reopen America movement, was one that I read about. I haven't seen anything on that specifically. And Plague of America was one that was mentioned. I understand that there is another rumor going around about the 5G wireless system contributing to this. Some rumors that Bill Gates is trying to make a lot of money, that Fauci was trying to make a lot of money out of it. And another one called QAnon. I'm not too familiar with it, but this thing has been around for a long time and deals with worldwide conspiracy theory. And it also, I think, has some ties with the pandemic thing, that there's a lot of overlap between some of these theories. But anyway, I think we need to be prepared to see and to give a good answer against many of these conspiracies. Also, the anti-vaxxer people, the people who are down on vaccinating against anything, are having a heyday, and they're involved trying to connect with all of these different conspiracies. I think one of the things we can do there to help there is just to simply refute whenever we see them popping up. Okay, well, now I'd like to take up the first topic that we get into, and now that we've dealt with what this virus is, and go through the items that we can do to take care of our own personal health. And the first one I spent some time talking about as I talked about the weaknesses of the virus, and that is avoid the virus. Where is it? We can't see it, but we can get a good idea where it's at. We have people at the county, at the state, and at the federal and international levels who are monitoring where the virus is and what it's doing. And I think we can use the information that we get from these places to help us to avoid. First of all, when we're in phase 0 of reentry, that is where we're in, people use words like lockdown or stay at home, things like that. I don't like those words because they kind of make it look like we're having to follow a strict rule of don't do anything, but that's not true. We don't need to stay at home. We do need to stay away from where the virus is. And especially elderly people need to do that. People who are overweight, people who have diabetes, hypertension, heart disease, kidney disease, and that sort of thing. And that means stay away from crowds. I remember when we first went into this, we were limiting groups of people to 25, not shaking hands and some of those other things that we were doing. Then it was down to 10 people in a group. And then with the complete basic closing down of much of the country, except the absolutely necessary items, we were not meeting at all except with people in the immediate family. Some of the people had to be out in public. The people who were working in grocery stores and maintaining the food chain, our health system had to be going to work. But even then, we found ways that you could avoid gaining any contact with strangers or with people you don't see all the time. So first of all, the distance. Social distancing, they call it, really physical distancing. The 6-foot rule is very useful. If you're just meeting somebody passing the other direction on a bicycle, that you're going to be in so little contact that it probably doesn't mean much. But if you're inside a room, you have to be even more careful because those little droplets can hang around and it can pile up if more than one person is coughing, and we don't know exactly how careful we have to be. But we do need to follow the rule of distancing as much as we can. And then the next thing that we didn't know much about before was that the mask can be helpful. It's not a perfect thing, but it can be helpful in preventing us from spreading it to other people. Now, if we didn't know that asymptomatic people could spread it, we wouldn't we wouldn't be thinking about the masks. But since we know that not only can we catch it from other people up close, we can also spread it, and wearing the mask is much more helpful in spreading it than it is in catching it. Because you can catch it through your eyes, and if your mask doesn't cover your eyes, you're not protecting them. So you have to remember that that the biggest importance of the mask is in protecting others. Washing our hands, very important, especially going in and out of doors, handling the grocery cart. Some people have thought about using gloves, but the gloves are only useful if you're using them for a particular task to keep from spreading anything on your hands onto something, and then taking the gloves off and putting new gloves on again if you're going to be doing something like that again. The gloves could be helpful if you're like somebody who is working in a grocery store and handling a lot of items, perhaps, and then you change them at the end of the day. But you have to realize that that can spread to other people from the gloves too, and can spread just as easy from the gloves as from the hands. So the mask is the most important thing there too. One important thing we do need to do in addition to staying away from people is to go ahead and get outside. We don't have to stay inside the house. In fact, if you have people coming in the house here, it's probably more dangerous than you going outside and meeting them at a safe distance outside. And getting outside for taking walks, if you're in a place where you can stay more than 6 feet away from people. Walking, cycling, all of those things can be very helpful. And we do know, of course, that sunlight does keep the virus down too. We don't know how much. But the sunlight also helps to give you vitamin D, which may be helpful in protection. One thing that I haven't seen emphasized enough, in my opinion, is to limit unnecessary travel. And that includes, well, travel in your car with people that you're always in contact with. That's not a problem, but contact with strangers, especially who may be transmitting the disease. You don't know where they've been. Especially a place like an airplane or a bus, or the worst of all, maybe the subway, where you have a different group of people every day, and if you're going to work on the subway, and that's why they have taken some extra measures there. And the mask becomes especially important in being courteous and responsible toward other people and not sneezing or coughing into that air that is full of people. Now, one thing I might mention is helping the elderly people, the sick people who shouldn't be out there, to get their groceries, to get their necessary medications, and there are lots of things that can be done for them, and we can also many things can be ordered online. Even food can be ordered from many of the grocery stores, and I know the grocery stores in our area have had ways of putting food outside, and you pay for it, and they bring it out, so you don't even have to go in the store. You just put your order in. There are a lot of ways that we can do that.
We do have a couple questions that have come in.
Okay.
And some people are going to make me say some really big words that are intimidating. So Linda would like to know about hydroxychloroquine.
Yes.
Hydroxychloroquine. Okay. All right.
Okay.
Tell us that there's a treatment apparently. Tell us about that.
Okay, hydroxychloroquine. I'm a little hesitant to speak about it because there's some controversies too, and I'll try to stay away from those as much as I can. And I did a little bit of reading on it even this morning. But hydroxychloroquine is a medication which is used for prevention of malaria. I think it had also been used for treatment. When I was in Nigeria, the last couple of years I was there, I used hydroxychloroquine once a week with my family to prevent malaria. And it was very effective. I never did catch malaria in the 20 years I was in Africa. And, you know, we missed, sometimes we would take it on Tuesday instead of Sunday, but we took it regularly. And it was very safe when used in that setting. The dose, of course, was smaller, and it was only once a week. So some of the dangers that might be associated with it weren't there. It's also used for people with rheumatoid arthritis, lupus, and a few other diseases. And has been very effective and helpful to some people for treatments. And there they may be taking it in a higher dose on a daily basis. And when they're taking it higher doses for long times, they have to watch their eyes because it can damage the retina. And also some people who have issues with their heart, with the rhythm of their heart, it can cause arrhythmias that can be fatal. And when used as a treatment, the concern was that if somebody already had damage to their heart, that the hydroxychloroquine could make it worse. And the studies that have been done using it as a treatment were some were maybe a little bit of help, but others were probably doesn't help. So we still don't know the answer there. One study I think showed that it could harm. But now as prevention, that's where it probably, if it's going to have any good use, will be the best. And there are studies going on with people who are working in the health field who are exposed to large quantities of the virus. They may get some help from it, and we have studies that we should hear about in the next week or two.
Well, that's exciting. We'll keep our ears open for that as well. Steve asked, can you explain the R0 measurement and why that's important?
Okay, the R0 is a number that refers to the number of people on average that a person with the disease is likely to spread it to. If each person who is infected spreads it to one person on average, then that would be the R0 would be 1. And the virus would continue to stick around. But it wouldn't grow into a pandemic. If the R0 is up to 5, as it seems like it could be if we don't do anything about it, the virus would spread to 5 people on average for everyone that it infects. So the mitigation and the mitigation basically is what has brought that R0 down. Things like public transportation, the density of population, a lot of other factors in the way people live, and the health, the age group that it's exposed to, will have an effect on that R0, and that's why it may be different in different places.
Okay. Now, Christy has a question, and I actually am wondering a very similar thing for my own family, and I've heard a lot of moms wonder this too. In February, in our area, around St. Louis especially, there was a really bad sickness. My kids were tested for flu, and came back negative. They were tested for strep, it came back negative. And so they said it's just a different virus. And so it sounds like Christy had a very similar thing. She visited California, and this is back before everyone was talking about it. She had what was like the flu and then a cough for 6 weeks following it. She's wondering, just like a lot of us are, is there any reason to get tested for antibodies?
There's a reason to get tested for antibodies. So I think there are 2 reasons, and they're different reasons. One reason would be to more clearly understand the virus, of course. and the question of when to get tested for that. Understanding the virus and knowing when it came might help us to know more about it. But the other reason would be to be tested perhaps at a later date, or even now on a widespread basis, and maybe even by testing a random sample of a community to know how many people actually are immune. So that would be the immunity testing. Testing for the virus itself wouldn't help because it probably will be gone anyway.
But can you catch this a second time?
We don't know. Simple answer. We simply don't know.
I think some people I've heard from, some of my medical professional friends, they've suggested probably can, it just might not be as bad the next time or something along those lines. Mm-hmm. And can we still be a carrier even if we've had it?
That's another question that we don't know whether there is a carrier phase that can be spread. We do know that some people can show the virus in their bodies for a long time. Also, they can spread it. We can find it in the feces, but we don't know if it's spread by the fecal route or not. We have no evidence that it is spread that way, as in the case of polio, for example.
Well, a lot of these questions, I think, are leading us into our next topic. You know, if we've already had it, are we safe to be around our constituents and whatnot? That would free us up, I think, a lot to do a little bit more in ministry than we're concerned about doing right now. But talk to us now about as you know, quarantine is lifted and we're going to be coming back together. How, I mean, you touched on it a little bit about how to keep ourselves safe and whatnot. How do we keep employees safe when we're sharing workspaces? How do we go minister to people, have people to our ministry centers to do the needed work of our organizations and keep people healthy, our volunteers, our constituents?
Okay, now that is going to vary from time to time and from place to place, to the point that we cannot say today what will be valid tomorrow. In the basic shutdown rules that we had were spelled out with the president's guide to the shutdown, 30 days to slow the spread of the virus. I don't know how many people are aware of that and have checked that out. The best place to get all of those recommendations is the Centers for Disease Control, CDC website, and that's coronavirus.gov. Gets you right to the place to get all that information. There you go. That's you've got the screen there, which shows where you can find that. Now, in addition to looking at that alert, which you can see there, check it out and see what those rules are for the 30 days to slow the spread. Now, that ended at the end of April. We're well into May, so we are starting the phase 1, phase 2, and phase 3 of the re-entry into the real world, or whatever you want to call it. So each state and each section of each state will be at a different phase at different times, and the rules are well spelled out as to when we will be ready to move into those 3 phases. We are in phase 1 in my county right now, in Oregon, and the only way to know what changes are going to be made is to stay in touch with your local health department, your city health department, your county health department, and your state health department. So I'm not going to give any rules that change. Just the principles that I gave you will be involved. And older people, I think, if they drag their feet a little bit, it's not going to hurt them. Sick people, people with diabetes.
We have a question too, sorry to pop in on that. What countries maybe are doing the best job at controlling the virus and whatnot, who should we be turning to internationally maybe to learn from in how to reopen and meet together again?
I have been studying that fairly carefully every day and watching what's happening. There were a few countries that weren't showing any activity in the past, and I was wondering, why did India not have a big outbreak? Why did Russia not have a big outbreak? How about Mexico? It turns out that those countries are starting to get it, but later. So I'm suspecting that they were just able to keep it out longer, and that our not factor might have come into play where in those countries where it was easier for it to stay out. But anyway, in terms of the countries that have faced it head on, Italy and Spain have probably done the worst. And Germany is ahead. They have had fewer deaths per 100,000 population, about somewhere around 10 deaths per 100,000 population in the epidemic, and now it's very low. We're having somewhere in the mid-20s per 100,000, but we are doing much better in the U.S. than in most countries. Sweden has had an approach where they had very minimal changes to their economy. They are not doing as well as we are doing. They're not doing as bad as some of the countries did, and I don't know exactly why.
So I know a lot of our Alma ministries operate very differently from one another. Some had a very easy time. We're all switching to online work. They had an easy time doing so because they're predominantly there anyway, or it was very a natural shift for them to make. Whereas some of them are more in-person ministries and whatnot. For our in-person ministries, as they are going to be gathering together again, do you have any encouragement for us or direction for us on things we should be thinking through as we're getting together, in addition to sifting through all of the things that are coming down from the government? What sorts of things should we be thinking about as we're considering? And again, most of our Alma people, especially who are on today, aren't congregations, but we're all members of congregations. And I'm sure a lot of us are connecting with our pastors and hearing about how do you commune groups of people when we're not supposed to be in larger groups of people. And the safest communion practice, probably that common cup for germ killing on the apparatus, but we'd be too close to take that common cup. I don't know. How can you give us some direction? How should we be thinking? What questions should we be asking ourselves as we are trying to create our plans to implement as we open back up again?
I think the most important thing is to pay attention to the physical distancing when we are in an enclosed area with a number of other people that we are not with every day. That physical distancing is important, but when we are just passing by someone, the amount of time where they're passing by is important. And we should try to limit that amount of time that we're in close contact. I don't really know, and I don't think anybody knows, for example, the communing thing. I would think that if we are using masks and not spending a lot of time in one place, that it's not going to be so big as we come out of this. Now, older people, people with diabetes need to pay special attention to maybe not being so quick to be involved in closer activities. But we will hopefully get to the point where we can hug and shake hands and do everything with our faces uncovered.
Yeah, that would be very nice. Okay, we're going to move into our last topic now with our remaining minutes. Talk to us about the effects of this pandemic. Talk to us about the effects of this pandemic on the global mission and missionaries in various countries.
Okay, well, first of all, let me take the missionaries. I think the missionaries need to know that in many parts of the world, the testing is not up to the level that we have here or what was done in Western Europe. If the statistics say there's not much around, not to take it too seriously, to be extra careful. The other thing is that some of the countries have even more stricter policies of isolation than we have. And I think we as Christians owe it to those countries to be respectful of their rules and to follow them as best we can. And in many cases, it may be more strict isolation than we have here.
Have you heard anything from specific missionaries? I know you have a close connection with, the Nigerian community and whatnot. Have you heard anything from overseas missionaries about support needed or some blessings maybe that they have seen coming through all of this?
I'm not the one to ask about that question because I really haven't had any contact recently with any of them. The contact I had in Nigeria was with a Nigerian person, the son of somebody who I was very close to when I was there 35.
Did you say 35 years ago?
Yes.
Okay. Well, we will keep tabs on that as Alma hears stories and whatnot, and we'll continue to post as best we can on social media if there are needs that can be shared in that medium. And through prayer requests and notices that come out in our newsletters as we gather information about this as well. We are at our time now, and I want to make sure everyone can get to their meetings. Before we are finished for today, there are two things that I'd like to do. First of all, if you could join me in thanking our speaker. I know we're all muted and whatnot. But John, thank you so much for being with us today and sharing your expertise with us. This has been pretty valuable for our time together, and I'm getting people texting me how fantastic this was. So thank you very much for that.
Well, thank you for having me here. It's been a good experience for me.
Excellent, thank you. I am going to actually invite to pop on one of our friends from Concordia Plan Services. I know not everybody has Concordia Plan as our health insurance, but for those that do, I would like to introduce you to someone. So as I am, let me give you just a little bit of background on this. Because we're talking about physical health of our church workers and our mission leaders, Alma is actually doing a fun little thing called a step challenge. A lot of us have, you can tell I don't have mine on, I just got it in the mail, activity trackers on our wrists. So your Apple Watch, I know our phones will have apps sometimes that can tell us how many steps we're taking in a day and whatnot. We did a really good job of social distancing in our family, so our greatest personal stressor physically during this time has been inactivity or just being at a computer and not getting out. Not only that, but my commute is about 15 steps that way, or all the cookies and the kids' lunch snacks and whatnot. So just keeping track of our own physical health as we're being, under our roof a lot more is really important. We're trying to get out more. So we're actually doing a step challenge. I invite you all to participate. We have a good number of people already signed up. And if in the email that you received the link to this, there was a sign up for the step challenge, please join us. We are going to be tracking our steps, and we're going to be on teams together. You'll be placed in a team of 3, and we're all going to be tracking our steps over the next month. This is a longer event because we want this to become part of who we are as God's leaders, being healthy in our own bodies. So as we are taking precautions with masks and whatnot, and I like my mask with my sunglasses look too, to protect my eyes. Dr. John said we got to protect our eyes too. So we're going to be walking together. We have an algorithm that, if you're a cyclist, we have an algorithm that will count your steps based on that. There will be prizes for the teams that for the team that has the person who improves most week to week. If you couldn't get a bunch of steps in and you're thinking to myself, oh, I'm letting my team down. If you can step it up in the next week, you can earn bonus points for your team. So everyone should be encouraged to join us on this and really try to get our physical bodies moving during this time. And especially it's a great way too to handle some stress. Megan is from Concordia Plan Services. For those of you who don't have a fitness tracker or who would like a new one, she has some really exciting information about Vitality. Megan, can you share with us?
Sure. So those that are part of the Concordia Health Plan, you've probably heard of Vitality before. It's a great platform that we have to not only get education, but to also work on physical, emotional, spiritual well-being, all the different components. But since you're doing a step challenge, wanted to remind everyone that if you're hooked in with a fitness device already, you'll also get points within Vitality as you're participating in the step challenge. So that's a good perk to this. The other thing is, since you might be thinking about getting a fitness device, each year Vitality offers a $100 subsidy towards a fitness device. So that can be a Fitbit, a Garmin. There's a whole bunch of options. If you go to Vitality, you go to rewards and go to fitness devices, you can see all the different devices that are available to purchase. Some of them are below 100, some are over, so it's up to you. If you want to pay a little bit extra or use your Vitality bucks, you can do that to get a device essentially for free. We also have the Apple Watch program as well. And the Apple Watch program it really just motivates individuals. If you want an Apple Watch, the more you exercise, the more you reduce your price towards that Apple Watch. So each month, your price of that Apple Watch could get lowered by how active you are. So all that information is on the website for you on Vitality. So if you go to powerofvitality.com, you can get that information. I also wanted to share with you that Concordia wants to help motivate you in your step challenge as well. So we also wanted to offer $25 Amazon gift cards to the winning team. So a little extra motivation. And then we also wanted to provide anybody who's on the Concordia Health Plan participating in the step challenge, we want to give you more Vitality points. So we'll be giving you, just for participating, everybody who's on the plan will get 35 Vitality points. And then we'll also be giving the top winner some additional Vitality points as well. So good reasons to get moving, although that's already a great excuse to get together, connect with each other again, and get moving. So
Megan, that is so very cool of you to help fuel our efforts and encourage our people to get moving and stay healthy. So thank you for that. Everybody join me in clapping. You can't hear them clap because we're all muted, but we're all clapping for you. Thank you very much. Thank you to Concordia Plan Services. And if you don't have to be in Concordia Plan Services to participate in our challenge, but if you are, you're going to get perks from them and from us. And giving the winning team $25 Amazon gift cards, that is pretty awesome too. I really appreciate your support of Alma's efforts in this as well. We also did get a $250 grant from Thrivent to purchase prizes for winners as well. So in addition to the $25 for the winning team, you guys will all get those. You'll get extra bonuses as well from that grant. And we're going to have different challenges, different prizes along the way. You don't have to be the overall winners in order to get prizes. So if you would like the full rules, go ahead and sign up, and those will be emailed to you so that you know what you're getting into. Megan, thank you for being with us today. And for those of you who have any more questions, if you want to stay on, I'll collect those for you, and maybe we can twist John's arm into answering some additional questions. And I think there was one more that came in as well. Thank you so much for being with us today. Next, like I mentioned, in June and July, we have 2 more webinars, and that would be on in June, addressing the financial health for our mission agencies, and in July, the relational and emotional health of our mission leaders, given all of the pressures that we're under as leaders of God's mission, especially in this time. There are already things we want to deal with because we are God's mission leaders in general, much less in times of pandemic. So thank you very much for being with us. I'm going to go ahead and stop recording now. And if anyone would like to stick around, we welcome you to do so. Thank you so much from Alma, and thank you again, Dr. Lautenschlager.